welcome back. Today, we continue our discussion about weight loss drugs and how they can help. Joining us once again is Dr. Scott Massie of My Medical Weight Loss. So welcome back.
Well, thank you. Thank you for having me back.
Yeah, so remind our viewers who maybe weren't watching yesterday a little bit about you and why you're so passionate about helping people to lose weight.
Sure. Well, I'm not just a doctor. I'm also a patient.
Yeah.
Well, a little bit about me. I'm a board certified internal medicine doctor, practicing about 13 years. Initially more pain management and primary care, but I've shifted to almost 100% weight loss over the past few years. And that had a lot to do with my personal journey too. It's been 40 years of struggle for me, and this is the first time I feel like I have some control in my life. I'm down over 60 pounds. I feel great. And I wanted to share that with other patients.
Yeah, well, let's talk about obesity because, it's dangerous, right? Can you talk about, why it's so dangerous?
Absolutely. And you hear a lot about the obesity epidemic, but probably a better way to describe it would be the obesity pandemic. It affects everybody in the world. I would say the cost of it, it's not all about the money, but it's important. It costs just in the United States about $1.4 trillion a year. From a death and disease standpoint, they estimate about 5 million extra deaths associated with obesity a year, and the types of chronic diseases that it's associated with, really every system in the body, things like heart disease, stroke, diabetes, kidney disease, neurodegenerative diseases like Alzheimer's. And it's also been linked to all sorts of cancers, including colon, brain, liver, and breast cancer too. So that's what's kind of amazing about these medicines. More and more research keeps coming out about the different things that this helps decrease the risk for.
Right.
Probably one of the first ones was heart disease, stroke.
Yeah.
But we're finding out it helps decrease inflammation, helps with pain. It even helps with some psychiatric diseases like depression, anxiety, and now we're even finding out it helps a lot of people with addiction, whether it's alcohol, nicotine, or other controlled substances. So we keep finding new things out about the health benefits.
Yeah, so we're talking about GLP-1s,
Yes,
right?
ma'am.
So tell me a little bit more about how they work.
Sure. So the GLP-1 agonists, the GLP-1 is referring to a receptor that we have, and those are found in our brain, stomach, and pancreas. The ones in our brain are what we call the hunger center. So these medicines travel to that area of the brain and basically tell your brain you're not hungry. Down in the stomach, those receptors slow down how fast food leaves your stomach. What that does, it puts a little extra stretch on the lining of the stomach, which sends another hormone called leptin to that same area of the brain and tells your brain, hey, you're eating enough, you should probably slow down, so you take in less food or calories. And in the pancreas, tells the pancreas to make a little bit of extra insulin, which cranks up your body's metabolism, so you're actually burning more energy even at rest.
Wow. Okay. So, and these are the drugs that we've heard about, Ozempic, and there are other names for them.
Probably the most famous ones. These medicines are in a family of medicines that we've been using since about 2005. But the most popular ones that most people have heard of now are semaglutide, which is the generic for Ozempic and Wegovy, and there's also tirzepatide, which is the generic for Mounjaro and Zepbound.
Okay, so I know these medicines, they can be expensive. So talk about the cost and what someone who's worried about that, what should they consider?
Sure, and that is a big issue. I've noticed over the past couple of years that it's getting harder and harder to get insurance to cover. So we have another program for those whose insurance doesn't cover the name brands, where there's a couple different compounding pharmacies. They're specialty pharmacies that make they don't make it, but they can sell the generic version. It's the same exact medicine, it's just in the generic form. And cost-wise, it depends on which medicine that you select. But also your dose. So most patients spend somewhere between $30 to $70 per week to be on this program.
Okay, and is there someone who would be a good candidate? And if so, how can they get started?
Sure. So, well, if there's weight that needs to be lost, then that would be a good candidate.
Okay.
But we talk about patient's individual specific goals when we have our medical consult. But to get started, very simple, easiest way, just go to our website, mymedicalweightloss.com, and we can schedule a no cost, no obligation medical consult. It seems like a lot of people prefer the video or telemedicine visit.
Definitely.
A lot of people have busy schedules. That's working nicely, especially if you don't happen to live close by to one of our clinics.
Yeah, and it's nice that you're actually communicating with a doctor. Yeah,
Absolutely,
that's the most important. Yeah.
absolutely.
Well, thank you so much for sharing all that information with us. Really appreciate it. And if you would like to learn more about what we just talked about and to get in touch with Dr. Massie, just head to mymedicalweightloss.com.